Welcome to the new electronic AER online system, brought to you by the New York State Department of Health, Office of Quality and Patient Safety. This web-based form is designed to make adverse event reporting easier than ever. As you know, by public health law, an adverse event should be reported to us within 3 business days. You can find the form at obsaer.health.ny.gov. Before we get started, please note the following information. There is no password needed. You can use any browser to complete this form, just make sure it is up to date. You must complete the form in one sitting. There is no option to save or partially complete. You can move from section to section, but if you leave the website completely, your information will be lost. You will be able to print out the form after submission. If at any time during your session you think you need assistance, please note the question mark at the top right of the page. There you will find multiple ways to contact us directly with your issue. If you are new to office-based surgery and adverse event reporting, this section provides common questions along with a little bit of a brief description of the office-based surgery program. If you feel that you cannot complete the form due to missing information, you will be able to contact us so that a representative can connect with you to review your information. There is also an electronic AER user guide should you need more guidance than this video. There are 12 sections to the AER form. In some sections, there are questions that are required and must be answered. You will know that you have answered each question when the red box changes to a green checkmark. Please note, if you are not affiliated with the OBS practice, certain sections of the form may not be required. Other helpful tips along the way. Before attempting to fill out your first form, we recommend using the yellow button at the bottom of the navigation to print out an offline version of the form, which can be used to collect your information before committing to the form. You can easily clear the form if you need to start over or have input too much incorrect information to continue. You will know when the form is complete and ready to submit when the AER button turns a deep yellow. Moving from section to section is allowed in the form using the Back and Next button or clicking on a specific section in the navigation pane located on the left side of the screen. This will not clear your information. Sections 1 through 2. The beginning of this report is where you will either start new or update a previously submitted report for your adverse event. You will need your credentials and your license number. There are 2 reports. One is for members of the OBS practice and one is for those not associated. Here is where you will make that separation. Although all fields are not required for mandated reporters not a member of the practice, as you complete the AER, you may provide any additional information in any of the sections if you feel it's necessary. For example, the practice information section is not required. However, if you do know any information about the practice, the location, or if you have a specialty, please provide that information. Section 3, Event Detail. This section has required fields. Please note, the date of discovery is the date you discovered the event occurred. Also in this section, you'll note the types of events. Some will require dates and hospital information if it is known to you. At the end, you will be able to describe the event in your own words, detailing the events and complications as they unfolded should more explanation be necessary. You can report multiple types of events in one report, but you must select at least one to move forward. When you select an event, it will prompt a drop-down to go into more information about the event. For instance, if reporting a death or suspected transmission of blood-borne pathogen, there will be more details to record, such as place of death, date of death, or autopsy details. The Observed Signs and Symptoms section is intended for the OBS practice. However, the Suspected or Known Complications section may apply to you. Select as many characteristics that apply, and they automatically get transferred to the column on the right. If you feel you've made a mistake, simply click on them again in the right column, and they will be removed from the list. Section 4, Procedures. Section 4 is where you will specify procedure data. Although this section is not a required section for the non-OBS member, as a reporter, please provide any information that you know regarding the procedure performed, such as the date of the procedure or any relevant procedure information. Section 5, Sedation and Anesthesia. The sedation and anesthesia section is also not required for the non-OBS member. However, if you have any information regarding sedation, for instance, if they were general anesthesia or a moderate sedation, please provide that information, as well as the sedation technique. Section 6. Participating staff. This section is also not a required section. However, again, if you're aware of the proceduralist's name, you can please enter that information here. Section 7. Patient demographics. Some of these fields are required. This is where we ask you to provide the basics of the patient's information, otherwise known as demographics. Here, you'll enter the patient's address, date of birth, gender, race, and ethnicity. The patient's social security number is optional. Section 8. Patient history. Medical history is an important section. If you are unaware of the patient's history, you will be able to click No Medical History to bypass this section. If there is an opportunity to get specific about each condition, it will prompt you, once clicked, to select a more specific type of medical definition. For example, if we check aneurysm in the cardiovascular section, you would indicate if it's abdominal, cerebral, or other. Section 9. Home medication. This section is also not required for the non-OBS member. If you are aware of the patient's medications, please provide that information here. Please provide a list of both the patient's prescription and over-the-counter home medication if it is known. If the patient was not taking any medication prior to the event, you are able to click None and bypass this section. You are able to hover over the question marks if you need more information on the types of drugs or drugs' names associated with each condition. You will be able to type in the information as well as in the text box to the right. Section 10. Quality improvement. This optional section is where you can report the event's impact on the patient. Please indicate what you feel the severity category for this adverse event is. If you click on the small blue question mark, you can see the definitions we use when we are triaging these events. These categories will help assign a severity. The second question indicates whether the adverse event was related to the procedure and the likelihood of the event being preventable. Please indicate any contributing factors to the event. Section 11. Upload additional documentation. It is typical that after an adverse event, you will have to upload medical records or additional documentation. A list of the types of records you may want to upload are listed. Please pay close attention to this information. Sections 12 and 13, Contact and Attestation. And finally, this section to list a contact person who the state can follow up with, and also to verify that what has been reported is factual. Once submitted, you will be supplied with a report reference ID number should you need to update the previously submitted AER. You may save and/or print a copy of the submitted AER by selecting the Print Confirmation and Submitted Data button located on the confirmation page. If at any time during your session you need assistance, please note the question mark at the top right of the page. There you will find multiple ways to contact us directly with your issue. Thank you for watching.